Hi, my name is Christian. I'll be performing today the central line dressing change video. So the first thing we want to do is establish two patient identifiers, name and date of birth. And then we also want to perform hand hygiene as well as provide privacy. Also, the supplies that we're going to be using today would be two gloves, surgical mask. We have our central line dressing change package right here, and then our patients right here with your catheter tubing right here and our bandage on top. Now, so if I want to disclose that I already used the bandage that was given, so I'm just using the package just to simulate the same thing as a bandage. I just have it on top. But okay, so now we can start the procedure. So hand hygiene, privacy, two patient identifiers. I want to instruct the patient to either turn their head during the procedure or to have a surgical mask. For this scenario, I'm just going to ask them to turn their head. Okay, now start putting on our gloves. I do want to note that on the catheter tubing, the clamp is on the distal end of the catheter. And then put on our surgical mask. So in removing the bandage, I want to use my non-dominant hand to stabilize the catheter. And then, so non-dominant hand on the catheter. And then for the bandage, I want to start on one corner. I want to remove the dressing from one corner to another, working inwards towards the site and pulling parallel towards the skin. So one corner to next, okay, and then moving parallel towards the skin. There we go. I'll put this right here, but normally we would discard that. Okay, now that that is removed, then we can remove our gloves. We'll do another set of hand hygiene. All this stuff will be disposed properly in the garbage, but for this purpose, I'm just gonna leave it right here. Now we're gonna start the sterile procedure. So we have our central line dressing package here. Okay, have it right here. So I want to open the package away from me. And then first thing I'm gonna do is grab the sterile gloves package. I wanna pinch the outer 1 inch border to maintain that sterile field. Okay, and then with my non-dominant hand, I want to grab the cuff. Okay. Okay. And then the next one. I want to interlock my fingers to make sure that gloves are on good. Okay. Now I want to grab the chlorhexidine right here. These edges right here, I'm gonna want to press on them, and then this will break and allow the fluid to soak into the pad right here, which I'll do. Okay, and then now that it's soaked, I'm gonna wanna get my forceps, grab the distal end of the catheter tubing, and pull outwards, okay, like this. And then with my chlorhexidine, I'm gonna wanna clean in a forward and backwards motion on all 4 sides. If I was using alcohol, I would wanna clean in a circular motion. And then I would also wanna clean for 30 seconds as well. So for this purpose, I'm not gonna clean for 30 seconds, but you know, so back and forth. on each side. Okay, just like this. And then also, depending on the size of the dressing, you're gonna want to clean towards that size of the dressing. So obviously, if you have a smaller dressing, you're gonna clean a smaller area. Bigger one, you're gonna clean a bigger dressing. And then also the bottom of the tubing, and then the top of the tubing. Okay, just like that. That's good. And then before applying the dressing, I want to make sure that our field is dry, which it is. So, okay, we're going to dispose of that. And then now we get our bandage. Okay. Tear off the wrapper like this. Okay, and we're gonna place it right on top. Okay, just like that. And then we're gonna want to remove these little borders. Just like this. Okay, just like that. And then there's a little, another piece right here that it's gonna be for the initial date and time. I'm gonna want to tear that off. Place it not on the dressing, because when there's the next dressing change, it can be removed. Just right on top of it, just right above it. Place right there. And then with our pen, you know, provide initial, date, and the time and gauge. Okay, now that that's done, this procedure is finished, but now I'm just gonna dispose of all the items in the garbage. Okay, right over here. Okay, just like that. And then, hand hygiene and exit the room. Thank you.